Welcome to Career Notes. My name's Lisa Post and I'm the careers coach here at the University of New England. And today we're going to discuss careers in psychology with Dr Warren Bartik. Welcome, Warren. Thank you to Careers Notes.
No problem, Lisa. Great to be here today.
Thank you. Can you tell us a bit about your role here at UNE and how you got to where you are now?
Sure. Look, professionally I'm trained and registered as a clinical psychologist, but my position here at the university is a senior lecturer in clinical psychology as part of our postgraduate programs, and currently I'm the acting director of the postgraduate programs here at UNE.
Great. And can you tell us what the pathway is to becoming a psychologist here at UNE?
Yep, look, there are a number of different pathways. The bottom line is that students need to move into professional practice, students need to complete a minimum fourth year. Now that fourth year at UNE currently is via an honours year in psychology. So students can do a Bachelor of Psychology honours, or they may do another Bachelor in Social Science or something like that, and then they apply for and gain entry hopefully into the honours component, psychology honours. But there's a minimum of that initial 4-year requirement. And some of the requirements there vary from year to year, so it'd be helpful for students to know that certainly for intake this year, for 2022, that students need to have a grade point average, so a GPA, I think it was 6.75. It does change each year though, so it's always important to look at the handbook that's published by UNE about the requirements for honours, but you need that minimum fourth year. And then from the fourth year, the only options that are available to you from 2022 are either doing what's called a 5+1 pathway, and that means completing a Master of Professional Psychology, which is additional fifth year training, and then you do an internship year. So that allows you, at the completion of that internship year, you need to undertake the National Psychology exam, and if you pass that exam, you then can become registered as a generalist psychologist, which allows you to practice. Now in previous years there used to be what we called the 4+2 pathway. So students could do their 4 years of educational training, and that's AQF, Australian Qualification Framework Level 8, so meaning 4 years of training, or AQF Level 7, which is 3 years of training plus that additional fourth year. You used to be able to do that level of training, and then you would apply for 2 years of registered practice supervision, where you would engage an external supervisor, but effectively you could hang your shingle somewhere, work as a provisional registered psychologist under the auspices of an external or of a place or a supervisor. That pathway is closed from June this year, and part of the rationale for that was, and this is a trend that's certainly happened overseas, where there are sort of minimum education requirements, and probably quite correctly that the auspicing board, so the Australian Health Practitioners Registration Agency, AHPRA, was saying that we need to have a sort of a set standard of initial skills and training that psychologists should have, and then they have their practical experience. So going back to what UNE offers here, we offer a Master of Professional Psychology, which is the fifth year component. And the unique thing about UNE's offering is that this is a totally online course. So students from right across Australia are enrolled in this course, and we started this in 2016, 17. Correct me, I could be wrong there, but it's 16, 17. And we put through, or we have about approximately 60 to 80 students every intake year. And because it's totally online, the students can actually stay where they are. They do core units, so core first year units, so things like psychological disorders, psychological interventions with adults, psychological testing, counselling and assessment skills, specific work around children and adolescents, but also applied clinical research, so thinking about how they, using that scientist practitioner model, how students might apply their readings, their scientific knowledge into their clinical practice. So students will complete a number of those components as part of the Master of Professional Psychology, but they also do what we call a simulated placement. And so, and this is the major, or one of the major components, and that again is a totally online experience, where students are exposed to about 11 or 12 different case scenarios, so people of different ages, different clinical presentations, and they observe and they actually role play with their other student partners aspects of that sort of clinical presentation, so assessments, intervention, write up case notes, write up treatment plans, all the things that you would be doing in an in vivo real placement, but you do that in a simulated online environment. Now, the beauty of UNE's offering is that a student never needs to leave home, and it's totally flexible. So if you work best after midnight, that's when you can be doing your study. But being mindful that it is a fair bit of work, and if you're going to look at a career in psychology, know that it is going to take some time and work. So that's the 5th year program. Then after you complete that successfully, then you do an external internship for 1 year, not the 2 years I mentioned before, the 4+2, but just the 1 year under an external supervisor. And once you complete that, you sit the National Psychology exam, and then you can have full registration as a psychologist. Now, the second pathway we offer at UNE, and both of these are having successfully completed the 4th year program and then applied, and there's a couple of things that you need to do. So there again, there's an expectation around the academic levels of the person who's applying in terms of their honours 4th year. They also need to provide a professional and a personal referee, and there's an application form. And so there's an initial screening process through the university, and then those applications come to the school where they're shortlisted again, and then there's a formal interview with the clinical psychology team around their appropriateness for clinical practice. So there's a process that people need to go through. And we know that a lot of people start university training in large numbers, and once it gets to 4th year, then those numbers whittle down, and then once you get to either the Master of Professional Psychology, the 5th year program, or I'll talk about in a moment the Master of Psychology Clinical, those numbers are potentially a lot smaller. And so the second pathway is the Master of Clinical Psychology. So completion of that 2 year full-time course allows you to with the following 2 years of registrar supervision to become a clinical psychologist. And the appropriate terminology is a registered psychologist with area of practice endorsement in clinical psychology. Now, that 2 year course, the Master of Psychology Clinical, you do exactly the same first year core units as the Master of Professional Psychology, but then you start to move into placement. So you do a placement at the University Psychology Clinic at the end of the first year, and then you have another 2 external placements to do in the second year, along with some advanced practice units. But you can see there's this level, what we call level 3, so it's the MPP, the Master of Professional Psychology, and then the package level 3 and 4, so you do the same first year units, and then you extend those skills with practical components and some advanced level intervention and assessment training. So they're the 2 pathways at UNE. Those pathways are similar at any other university across Australia. Not all universities offer the 5th year, the 5+1 pathway. Certainly UNE is one of the only ones at the moment that offers that entirely online. And if you want to do your placement under a Master of Professional Psychology and you want to do it in a real in vivo, in situ placement, UNE is not going to be the option for you, because the only alternative is doing it online. But we find the students who undertake that online unit, the online simulated placement, have such an experience of a range of clients and a range of clinical presentations. And we've had feedback from the employers and internship supervisors who value our students who have had that experience over those students who have had like a person-to-person placement experience, if you like.
Yeah, that's interesting. Thanks.
So hopefully I've explained those pathways, which are, as I said, they're the same across all universities, but uniquely what we offer here at UNE.
Yeah. And can you tell us what the difference is between being registered as a general psychologist and a clinical psychologist?
So tapping on to what I just mentioned about those pathways, so once you complete the 5+1 or the 5th year pathway and you complete the exam, you can then be a general registered psychologist. And if you think about a general registered psychologist is allowed to and must be delivering focused psychological strategies that are established by Medicare. And so there's certain areas of intervention skills, so that might be cognitive behavioural therapy, narrative therapy, interpersonal psychotherapy, psychoeducation, motivational interviewing. Those things are actually approved evidence-based practices that a general psychologist can offer. The difference for a clinical psychologist, so again, that's a general psychologist who has area of practice endorsement, is that clinical psychologist completes their 2 years with us as part of the Master of Psychology Clinical, but then they have to have 2 years of registrar supervised practice where they need to provide 3,000 hours across those 2 years of working time, and they need to have 80 hours of supervision and 40 or 60 hours of continuing professional development. So there's an extra level of skills that they've got to meet. and then they can apply for area of practice endorsements, and then they're called clinical psychologists. Now, in the current systems we have in Australia, particularly under Medicare, that there's a two-tier payment system. So if you're a generalist psychologist, the Medicare rebate to your client is a set figure. If you're being seen by a clinical psychologist, the rebate is higher. So I guess the implication is that clinical psychologists, because of their additional training and additional experience, are able to charge a higher fee, and those clients are able to rebate a higher fee as well. So that's probably the main difference between the two.
Yeah.
Having said that, we're training all our students at uni in the same evidence-based practices. So it's not, one group isn't necessarily different to another. There's an advanced level of training that happens for a clinical psychologist, and that plays out in fees and things like that, if you like.
And what transferable skills does the study of psychology give students at uni?
Look, the skills that someone who undertakes, whether this is undergraduate units in psychology, whether it's completion of the fourth year honours, those skills are immense for anybody, because it teaches you how to interact with people, how to gauge and judge the things that you read, so to consider your interactions, with clients of agencies, or with other staff you work with, or just people in general. And so we find that people who've completed psychology undergraduate degrees are far more proficient and understanding about those sorts of interactions. So I'd say any sort of role, and largely we're talking government-based roles, but there could be other things as well, where there's interaction with people, these skills are going to be very transferable. So if you think about agencies that, for example, people who might work in out-of-home care, who might be direct care workers or contact supervisors, having psychology under your belt, even if it's not to that sort of application practice of the fifth or the sixth year, those skills are going to be really important about how you understand or better understand the clients and the people you're working with, but also in various other agencies, and it could be in health portfolios or community services and justice portfolios, and they're called different things in different states, of course, but where you're working with vulnerable people, but not in a direct clinical role, but perhaps maybe in a more administrative support role or a case management role. The skills that you learn through undergraduate psychology are really, really valuable to how you can apply those across career. So even if you don't want to and don't end up in the application, being a registered psychologist or being a clinical psychologist, those skills are going to stand you really, really well in terms of the work that you do.
Yeah, absolutely. That's great. And why do you love this field of study?
Look, I think... and I guess we all probably have things that we either feel good at or we enjoy doing. And I guess for myself, it's knowing that I can translate the skills and the things that I learn into actually helping and assisting the clients that I work with. And I think that's, and again, as human beings, we all have different things that are important for our values or the things that we do. But it's probably a universal, by and large, it's a universal trait that we actually want to assist those that we work with. And when we're human beings, we live in a society where we live and work with others, and we generally want those things to all get on and work fairly well. And if I'm able to use my training and skills to actually assist in that process, that's what I find valuable, and that's really what I love. And I think, working with the students that I work with in the clinical program and working in their training, I really love to see the escalation or that sort of transition of their start of knowledge, where they say, I don't know anything, I can't do anything about this, or I don't know what I'm doing, to when they get to the end of the training and they're ready to go out into the workforce and actually help people, and particularly for UNE's perspective, because we have this focus on wanting to improve the health outcomes for rural and regional communities. Yeah. And certainly a lot of our training is focused around that broader aspect of skills delivery, because if you're working in rural regional areas, you can't be a specialised. You actually need to be working more with people in the community, because there may not be other services around. Yeah. And just seeing that people are going out after our training and being work ready and able to step in and assist the communities is just, I love that. I love that aspect of training. I love the aspect of being a clinical psychologist where I can deliver that myself. And
looking back, did you ever imagine yourself in this line of work? Were there any distinctive forks in the road that got you onto this path?
Yeah, look, I'd probably say there were. So, going way back in terms of my very first university degree, I was going down the fine arts archaeology focus. So I'd made my senior years at high school were around fine arts, and that's where I saw myself maybe being a fine arts teacher or working in that industry. And as I was progressing through my studies at the particular university I went to, because I was focused on archaeology and fine arts, that I thought, museum curatorship or something along those lines was where my interests lay at that time. And for a whole number of reasons, I'd completed my initial 3-year degree, and I deferred pursuing, the museum curatorship that was offered by that university, and I went into the workforce. And I found myself working in government agencies, this is in the New South Wales Public Service, that were working with vulnerable people with chronic mental illness, people with comorbid disabilities, a whole range of other things that were impacting their lives. And the sort of the case management type roles that I was working with in those government agencies was allowing me to assist and work with those clients, with those consumers. I kept deferring my museum curatorship for a number of years, and by the time I thought I might apply for it, the university said, you know what, it's been X amount of years, we're probably not even going to consider you. But that was okay, because by that stage I was working as a youth worker in New South Wales in the community welfare system, so with vulnerable adolescents in out-of-home care. And if you think about adolescents in out-of-home care, family, foster care alternatives, they're no longer options for them. So these kids are pretty damaged, pretty vulnerable. And I just really loved that work that I was doing. I love the fact that I can engage with those young people and hopefully make some difference in their lives. May not have seen that at the time. They may not have seen that at the time. But that started this ball rolling around, because I was working with other members of the team who were psychologists, who were social workers. And I thought, okay, this is the inspiration for me to actually upgrade my skills. So I took myself back to university and I did sort of graduate diplomas in psychology, and then honours equivalent, so a master's preliminary, which then led me to undertaking my clinical master's study, and then my PhD, and now here I am many years later in the role where am a clinical psychologist, and I'm also involved in the training and development of people like me many years ago to help foster their interests and their skills as well. And I just say, yes, there were some forks in the road, but I guess things happen sometimes for a reason, and we all talk about those sliding door moments. So there were a couple of sliding door moments for me, but if I look back on if I think back where I was and where I've got to now, this is exactly the pathway that I was always going to be on, and it just gives me such value in my life about what I can offer and help, both in terms of a teaching capacity, but also in delivery of my clinical services to the community and to people as well.
Yeah, that's wonderful. Thank you for sharing that.
No problem, Lisa.
Any advice to students who are embarking on this journey to become a psychologist?
Yeah, certainly maybe just reflecting back on what I've just said, that sometimes we'll make decisions for different reasons. And it may well be that we think, several years have passed, I've done my study, maybe this is something I want to do. So I should probably just mention that certainly when you are coming into that postgraduate study, so the Masters of Professional Psychology or the Clinical Master Study, there is what we call this 10-year rule. So your qualifications, that fourth-year qualifications, needs to be within the last 10 years, unless you can demonstrate that there's been some active continuing professional development to match the AHPRA, so the Australian Health Practitioner Regulation Agency, to match some of their requirements around ongoing development. If you can substantiate that, UNE and some other universities will offer a little bit more flexibility with that 10-year rule. So, but I guess coming back to your question, my point might be that maybe you've made some decision, you finished psychology a while ago, or you did a couple of subjects and that sort of sparked your interest in this. It's never too late to get into that field. And even if you are well outside that 10-year rule, that doesn't mean you can't apply those skills, but I think there are always pathways, and I guess one of the unique things about UNE is we've tried to work really hard to create these pathways, because again, as I mentioned, we have this desire to improve the capacity of care for our communities, and so we're trying to accommodate people with the flexibility through our MPP fifth-year degree, but also that kind of really hands-on focused training that happens as part of our Masters of Clinical Psychology training. So there are always options there, I guess, is my message for people who might be thinking, where do I go, what am I doing? And there's so much diversity within the psychology profession, so whether it's working in private practice, whether that's working in government agencies such as Communities and Justice, or within the health system, both in paediatric care, older persons' mental health, acute chronic care, comorbidities, mental health teams, inpatient environments, so both involuntary inpatient environments and others. But there's so many different agencies that either as a psychologist or bringing those skills to the fore in the work that you do is applicable. So it's a really relevant skill and a really relevant career path to choose, I would say.
Yeah, that's great. Thank you so much for joining us today.
No problem, Lisa. I hope that's been helpful.
It has. Thank you so much.
No problem.
Thank you.